Good afternoon, everyone. My name is Pamela Annan, and today I will be presenting my CSI final capstone project on a web-based remote medical assistant. Now, the problem is that there is little fundamental progress in the implementation of telemedicine devices in Ghana due to low funding and lack of governmental support, according to Tichau and Aqua. Now, one may ask, what is telemedicine? Well, it is basically the fusion of information and technology for quicker remote health consultation to patients. Now, some related works that's helped in the development of this project include the Connect Care system in Alberta, Canada, which uses a data repository to store patient treatment and diagnosis data. The Bima Ghana telemedicine system that offers SMS health coaching to educate patients on certain health topics. The MD Live system, which is a telemedicine provider that allows AI chatbot functionalities for system assistance to both patients and doctors who use the MD Live platform. Now, the solution I propose to this problem is to develop a telemedicine device for patients, specifically the aged and mobility impaired of Rima Rafa Medical Center. The motivation behind this project is to help achieve SDG 3, which is promoting good and healthy lives while encouraging all people's well-being. And the fact that the COVID-19 pandemic placed restrictions on receiving medical attention physically. Now, the requirements for this project were gathered using the convenience sampling technique, with questionnaires and surveys handed out to a sample size of 20 participants and 15 complete responses at the end. Now, the three major stakeholders identified for this project include the pharmacists, doctors, and patients of Rima Rafa Medical Center. These stakeholders helped in the identification of the functional requirements, such as health consultation in a dispensary unit, and the non-functional requirements, such as the security and performance requirements. Now, for the design and implementation of this project, Agile Development Lifecycle was adopted to meet customer satisfaction, and the Scrum framework was used for easy user iterations. Now, the 3-tier architecture and the MVC design patterns were also utilized in this project to separate the different layers, that is the client tier, the logical tier, and the database tier, to facilitate changes made on the separate layers. Now, web development languages such as PHP, JavaScript, MySQL, and CSS, and Microsoft Azure and APIs, and other technologies were utilized in the development of this project. This is a screenshot of the doctor chat forum. Now, the main testing discussed in this presentation is a user acceptance testing, which is a test of the interface and functionalities of the system by the users to assess their desirability. So the system was deployed on the Microsoft Azure Live server, and the link handed out to a total of 20 participants. 3 of these participants were doctors, 2 pharmacists, and the rest being patients. Now, a total of 17 successful respondents were received at the end of the survey. And the general desire of the system was realized with an 88.3% user approval of the system's functionalities. Now, for the demo of the project, here a user is logged in as a patient, here a user is logged in as a doctor, and here a user is logged in as a pharmacist. So now on the patient forum, the patient communicates with the doctor saying, if they wish to interact with the chatbot, they have liberty to communicate here. On the doctor's end, he notices the patient has sent a message. And writes something back to the patient. Now the doctor alerts the pharmacist of a new prescription. In a situation where the doctor believes the patient needs to come into the hospital for further tests, he alerts the patient of this need and the patient goes into the hospital. So here the pharmacist just alerts the doctor that he's aware of the new prescription. Now the pharmacist goes to the prescription logs, views older prescriptions, and this is what was written just today. Panadol, 200 grams. So that's assuming 4 packs, I guess. 2 tablets, 3 times after meal. Add to cart. So it is now added to the patient's cart. Now the pharmacist alerts the doctor. Now on the doctor's end, he's received messages from the pharmacist. And now he alerts. Now the patient views the chart with the doctor and sees, I will get you something and kindly make payment. So the patient goes to their cart and sees that the Panadol has been added, the price, the quantity, and the prescription. And this is the summary of the patient's cart. So the patient pays with Paystack. This Paystack payment is in test mode. And he receives his receipts and is allowed to print. And now his cart is emptied. So now limitations and challenges faced during the development of this project is the video chat API appeared to be irresponsive due to some authentication issues. And these authentication issues were not addressed due to time constraints. Another limitation was the system's resolution was only limited to widescreen devices. So basically the system doesn't work as expected on mobile devices. Now, a general conclusion for this project is that the MediCare system is detected to support remote consultation, and this helps in achieving one of the targets of SDG 3, which is universal health coverage. And it does this by providing remote consultation during this ongoing COVID-19 pandemic. Thank you. And here are the list of references.